Hey everybody, it's Dr. Gilchrist, and we are finishing up week 4 by talking about inhalants and GHB. So just as a quick overview, again, we're going to start by talking about inhalants. I'm going to give you some background about different types of inhalants, and then we'll talk a bit about the behavioral and neural effects, and then we'll do the same for GHB, which is better known as gamma hydroxybutyrate. So let's start by talking about inhalants. So inhalants are basically a broad class of abuse substances. Now, here's what's kind of interesting. A lot of the drugs that we've been talking about are illicit in certain forms. So certain classes of opioids are illicit. Marijuana is illicit. Certain types of hallucinogens are illicit. But much like caffeine, oftentimes what we are going to find is that inhalants are perfectly legal and they can easily be purchased in stores by people of any age. Now, this is starting to change a little bit. If you go into certain stores and you want to buy things like spray paint, or if you want to be able to purchase certain types of glues or adhesives that might have inhalant properties, usually you are going to have to show you are above 18. But most inhalants are pretty easy to find, and they're readily accessible in the home. They're very easy to find. And one of the things that's kind of interesting is that users are typically going to be children or adolescents for this reason. Generally, most first use of inhalants is typically going to occur between the ages of 12 and 16, and the age of the average user of inhalants is 14 years old. And folks, this is an average, which means that that's also the weighted average of people who are older. So generally, one of the things we find is that inhalants are often going to be used by children or adolescents because they are what's available and they're easier to find. So inhalants are basically some of the following. They are either going to be volatile liquids, and volatile here means that they're very easily vaporized, they very easily turn into gas, or they are gases at room temperature, and they're used by inhaling fumes in a variety of different ways. So this can include things like inhaling fumes from a rag that is saturated with the substance. This is known as huffing. Sniffing fumes from a container. This is sniffing or snorting. Inhaling fumes from the substance in a plastic or paper bag, which is called bagging. Inhaling from a balloon. Spraying the aerosol directly into the nose or the mouth. And this is sometimes referred to, if you're using a can of air freshener, this has been referred to as Glading because the brand name of one type of air freshener is Glade. Or dusting from dust removal spray cans, like the kind that you might see for computers or keyboards. And generally, here's what else is critical. They cannot belong to another defined class of abused substances that can be inhaled through smoking. So they can't be nicotine, THC, cocaine, or other classes of drugs. Now, I want to go through a list of commonly abused substances, and you can see that there are a variety of different ones here. So acetone, you probably know acetone best from things like nail polish remover or paint thinner. So we have our volatile solvents, hexane, which is a degreaser or an adhesive, methanol, a paint remover or a degreaser, methylene chloride. I'm going to focus more on the principal uses: spray paint, marker pens, lighter fluid, mothballs, toilet fresheners, toluene, which we're actually going to spend a lot of time talking about. That's present in things like spray paint, adhesives, paint remover. In terms of fuel, that includes things like butane, which is often used for cigarette lighters and propellants, gasoline, kerosene, which is a lighter fluid or lamp oil, naphtha, and propane. We have halogenated hydrocarbons. These will include different types of gases and coolants, so compressed gas computer duster, propellants, refrigerants, again, degreasers, spot removers. This one, trichloroethane, which is present in like whiteout, ink correction fluid, dry cleaning solvent, degreasers as well. We also have anesthetics like chloroform, ether, and nitrous oxide, which is a dental anesthetic, and it's also present in whipped cream dispensers, and it's not that uncommon to hear about people doing what are called whippets. They will basically try to inhale fumes from the can so that they can get the nitrous oxide, and because it's in a whipped cream can, it is sometimes referred to as a whippet. We're also going to talk about our nitrites, amyl nitrate, which are poppers, and then butyl nitrate, which again are poppers, but can also serve as head cleaners for things like VHS tapes, for those who still know what VHS tapes are besides myself. So like I said, the inhalants are often, and in addition to this, this includes things like glues, which can also be huffed. So again, a volatile solvent. So these include volatile solvents, fuels, hydrocarbons, nitrites, and anesthetic. So when I talk about a volatile solvent, we're talking about liquid, things that are liquid at room temperature. They can be converted into gases at some point, but they give off fumes that are inhalable, such as glue, paint thinner, and so on. We have fuels, which can basically be volatile liquids or gases. We have hydrocarbons, which are basically hydrocarbon molecules with one or more chlorine or fluorine atoms, like degreaser. We have nitrites, which are known as poppers, and we're not really going to talk that much about poppers like amyl and butyl nitrite. They are basically typically used to heighten sexual arousal and pleasure, and they work differently from other inhalants. Inhalants are often thought to work directly on nerves and nerve cells and neurons, but nitrites dilate blood vessels, and they basically cause muscle relaxation. In addition, we have anesthetics like nitrous oxide, which is laughing gas, ether, and chloroform. Another version that I will mention that is not in your notes, inhalants can also be aerosols, so sprays that contain solvents and propellants. So that can include things like hairspray, deodorant spray, spray paint, vegetable oil sprays, and household cleaners. So inhalants are abused for a few different reasons, and the main reason is that the items are legal. You usually don't have to get ID'd for them, but this is changing. And additionally, they're very easy to find. They are very rapidly absorbed, and they do end up crossing the blood-brain barrier, and their effects work and wear off very quickly. And so because they tend to work very quickly, you can basically use quickly, and typically because they work as quickly as they do, they will not, you can basically get high and your parents or the people at school aren't going to know that you did it. So their effects work and wear off very quickly. And we're going to largely talk about inhalant doses as being calculated as the amount of chemical in the air in terms of parts per million, or ppm. So now let's talk a little bit about some of the physiological effects of inhalants. So what are the acute effects of inhalants? Well, one of the things that's kind of interesting is that inhalants actually work pretty similarly to alcohol. So you're going to get some mild stimulating effects with very small doses. So you're going to get things like euphoria, you're going to get stimulation and disinhibition, and this will later be followed by drowsiness or lightheadedness. Now, if you have a greater exposure, like a larger dose, that's going to cause more stronger depressant effects. So again, this does kind of look like alcohol. Alcohol exerts stimulant effects at lower doses and greater depressant effects at higher doses. So somebody that has a heavy dose of an inhalant may experience things like slurred speech, poor coordination, ataxia, difficulty moving the muscles, and lethargy. Additionally, sensory distortions and hallucinations can actually occur. Very high doses can actually lead to anesthetic effects, loss of consciousness, and even coma. Now, one other thing that I will mention that makes it kind of hard to study inhalants is that the frequency of use actually will modify the effects as well as the dose. So low frequency inhalant users are going to largely report the positive effects that they feel, like the euphoria, but a higher frequency user is going to get a mixture of positive but also aversive effects, things like depressed mood, irritability, or suicidal thoughts. In fact, high-frequency users may actually experience delusions while they take the drug, including a delusion that one might be able to fly. Researchers actually found that inhalant users who thought they could fly actually did try to jump out of windows or trees, leading to broken bones and minor injuries, but thankfully nobody has actually died because of this, at least in that particular study. Now, tolerance and dependence is pretty rare, but some users do report developing a tolerance to inhalants and a dependence upon inhalants. So oftentimes they are going to need to take more of an inhalant to get that euphoric effect that they're wanting so much. There's additional evidence that there is a withdrawal syndrome with inhalants, and this will include things like nausea, fatigue, irritability and anxiety, difficulty sleeping, and cravings for inhalants. But the thing is, because we don't really know that much about how inhalant substance use is treated, there are no specific treatments for abuse or dependence. The typical approaches will probably be things like 12-step programs, cognitive behavioral therapy, motivational therapy, kind of trying to think about the motivations and help set goals, and family therapy. Now, one of the things that we do know, and to be fair, there hasn't necessarily been a lot of research on this, and part of the reason that it's difficult to study inhalants, especially in animals, it's really hard to control airborne delivery of these substances who want to model human exposure in animals. But researchers have actually found that inhalants can be reinforcing. In one particular study, they actually administered toluene to rats. Basically, they were in a place conditioning study. So rats and mice were basically put in an airtight inhalation shuttle box. So a shuttle box is basically, there are two different sides to a chamber. One compartment had toluene. In particular, they were exposed to about 700 parts per million toluene. And then on the other hand, they had another chamber that had nothing in it. And what they basically found is that exposure to 700 parts per million or more, so larger doses of toluene, actually led to a preference in mice and rats for going to that particular side of the chamber. Notice that when the toluene dose is smaller, like 350 parts per million, you can see that there's considerably less of a preference for that drug paired space. And toluene is present in things like paint thinner, in solvent, and in nail polish remover. One of the other things that we have found is that animals will self-administer toluene via IV, and additionally, the presence of toluene can actually enhance intracranial self-administration, indicating that these have very strong reinforcing properties. Now, what brain areas cause this reinforcement? And again, inhalants aren't very well understood. They aren't often studied, and as a result, the neural mechanisms are not well understood. But researchers' best guesses have been the ventral tegmental area of the midbrain. And remember that we're only focusing on toluene here because toluene is the only one that has been studied. We can't say if this would be true for other types of inhalants. So we do know that toluene does activate dopaminergic neurons in the ventral tegmental area, and it also increases dopamine levels in the forebrain, particularly in areas like the striatum, the nucleus accumbens, and the prefrontal cortex. Now, it does have similar depressant effects to alcohol. Toluene is actually the most commonly abused inhalant, and that's why we're talking about it the most. It is a non-competitive antagonist for NMDA receptors. Those are glutamate receptors, and remember that glutamate is largely an excitatory neurotransmitter. So it actually ultimately will reduce glutamate binding. Additionally, toluene increases activation of GABA A receptors, meaning that we're getting some inhibitory properties, and it also inhibits nicotinic receptors. And again, nicotinic receptors work on acetylcholine. They are largely excitatory. So again, through all of these actions, we end up getting depressant effects. And the other thing that we know is that chronic use can lead to enhanced metabolism. We know that the GABA A receptors downregulate, they reduce their numbers when you take more inhalants, and NMDA receptors will upregulate. Now, because of this, the mechanisms of action really aren't well known either, and that's partially because there are just way too many different types of inhalants with different chemical substances, and as a result, each of them may potentially work differently. But one of the things that we do know is that all inhalants are very highly lipid soluble, and this means that they are going to rapidly be absorbed from the lungs as soon as you inhale, and they're going to enter the brain. In particular, an area of the brain that is especially susceptible to inhalants is the white matter of the brain. Remember that the white matter of the brain is largely made up of myelinated axons, which are very fatty. As a result, they are very fatty areas of the brain, and inhalants bind very readily to these white matter areas. So what can this look like? So what you're looking at here in this particular figure is toluene concentration in the brain of a baboon. This is a PET scan. So here we have toluene concentration in this PET scan. Redder colors mean higher concentration. Cooler colors like blue and purple mean a lower concentration. And what you can see is that there's a very high uptake in areas like the striatum, the thalamus, and in the cerebellum. And localization of these areas has to be considered if you want to know what the effects of a particular inhalant are going to be. So, what sort of behavioral effects happen with toluene? So, one of the things that we find again, remember that with inhalants in smaller doses, we have stimulating effects. In higher doses, we get depressant effects. We do see increased locomotor activity in rodents, but this is going to be really dose dependent. We know that up to 1,000 parts per million, we see increased activity, but above 1,000 parts per million, we start to get those depressant sedative effects. We also know that other inhalants, such as ethanol, do produce similar effects. Now, for humans, there are going to be 4 different stages of effects. So in stage 1, people are going to experience stimulant-like, very positive effects like euphoria and excitation. Stage 2 are the alcohol-like effects, things like disorientation, slurred speech, confusion, maybe some hallucinations, but they're pretty rare. And for most people, this is where you're going to stay. If you take a larger dose, you're going to get those enhanced depressant effects. Your sensations are going to be blunted, not as sharp as they could be, and you're going to have that poor motor coordination. You're going to have that ataxia. At overdose, you may experience a stupor, a loss of consciousness. In particular, you might experience seizures in high doses, failed breathing, and potentially cardiac arrest. Now, what are some of the different risks of inhalants? So one of the things that we know is what is referred to as sudden sniffing death syndrome. And yes, this is an actual thing. Oftentimes, what we are going to find is that inhalants can potentially cause cardiac arrhythmia. We end up getting a change to our heart rhythm. And what we find is that for some people with that first opportunity to inhale, they experience cardiac arrest, and they also will have low oxygen levels. Now, this is not going to happen to most people, but most people who repeatedly use may experience damage to the heart, the liver, the kidneys, the lungs, and the bones. Now, I mentioned previously that inhalants are very fat soluble, and white matter is made of fat, and as a result, inhalants bind very readily to the white matter. So repeated chronic use can affect white matter. You may experience things like white matter degeneration, cerebellar dysfunction, as well as nerve damage. Additionally, some people have reported experiencing anemia due to bone marrow toxicity, as well as deactivated B12, and that's particularly true if you are abusing nitrous oxide. B12 is really critical for neurological function. It's present in a lot of meat. It's part of the reason why for people who don't eat meat, they often will need to take a B12 supplement because of those neurological effects that an absence of B12 can produce. Additionally, we know that toluene abuse is associated with cognitive impairments, memory impairments, and motivational impairment, but this can be recoverable if abstinence from inhalants occurs for several years. Here are some other things that people have found from MRI findings in chronic abusers. So the apathy and inattention that one may experience is due to damage to the cerebral, the cerebellar, and brainstem atrophy. Memory impairment is due to the enlargement of the ventricles, which is related to that atrophy. And then visuospatial dysfunction is due to the loss of gray-white matter differentiation. And one of the things that I will mention, because it is so fat soluble, it also can affect fetal development by crossing through the placenta. Infants that are born to inhalant abusers are often going to be born prematurely with low birth weights, and they have very similar physical malformations of the head and face, very similar to fetal alcohol syndrome, and as a result, this has been called fetal solvent syndrome. So now we're going to finish up by talking about GHB, also known as gamma hydroxybutyrate. So GHB, as you can kind of see here, is very similar in its chemical structure to GABA. So GHB is structurally similar, and it's structurally similar for a very good reason. GHB is actually produced in the brain as a byproduct of GABA metabolism. So here you can kind of see the different steps in GABA metabolism. So we have GABA, the enzyme GABA aminotransferase basically breaks that down into succinic semialdehyde. Succinic semialdehyde reductase produces GHB, and succinic semialdehyde dehydrogenase produces succinic acid. Now, GHB can actually be taken up into GABAergic vesicles by what is called the vesicular inhibitory amino acid transporter, or VIAT. And additionally, researchers have found that some GHB can actually be co-released with GABA whenever a neuron fires. However, we're largely going to focus on GHB that is taken outside of the system. So it's not an endogenous GHB that we're producing. It is an exogenous GHB that we use. So GHB was basically discovered around 1960 or so in a search for a GABA analog to be used for therapeutic purposes. And early studies did actually show that GHB does produce sedation. It can even produce anesthesia in lab animals and humans. It's not the best thing that we use as an anesthetic, and so it eventually kind of fell out of popularity. But it did, in the 1980s, start to be sold as a dietary supplement for bodybuilders. And there wasn't really a lot of evidence for this, but GHB was claimed to reduce body fat and enhance muscle mass through its ability to basically stimulate growth hormone by the pituitary gland. In actuality, we do know that GHB deepens sleep, and if there are growth hormones being released, it is often occurring during rest. And over time, it was recreationally used as a club drug. The FDA started to receive reported GHB-related illnesses, and they basically stopped selling it over the counter. Despite that FDA ban, it started to get used more as a club drug, and it had a variety of different street names like Liquid X, Liquid E, probably my favorite one, Georgia Homeboy, because it says GHB, Grievous Bodily Harm, Cherry Meth, Organic Quaalude, Nature's Quaalude, and it's still actually available from internet sellers. You can basically find GHB precursors that are sold for basically compounding purposes, and you can synthesize that GHB at home or for direct consumption. And unfortunately, because it is used as a club drug because of its intoxicating effects, it has also been used in sexual assaults. So it's very intoxicating, and it's very sedating at high doses. And often what would happen is that it would be added to a drink without somebody's knowledge. And why you would do this is because it is easily dissolved in liquids, it's colorless, and it's nearly tasteless. And as a result, GHB and its precursors were actually designated as a Schedule I controlled substance in 2000. So now let's talk a little bit about some of the different physiological effects of GHB. So GHB is usually going to be sold as a solution in water. You can buy it as a solid powdery material, but you're more often than not going to get it dissolved in a liquid. Oral administration is going to be pretty common. It's rapidly absorbed from the gastrointestinal tract and it readily crosses the blood-brain barrier. And like we saw with inhalants, low doses will produce a very alcohol-like experience. You will experience things like some mild euphoria, some relaxation, and some social inhibition. Now, what happens at higher doses? And again, this is gonna look pretty similar to what we saw with inhalants. Higher doses can cause lethargy, can also cause ataxia, slurring of speech, dizziness, nausea, and vomiting. Overdosing is really dangerous, and this can either occur because of higher doses of GHB or mixing GHB with other types of depressants like alcohol. So respiration will often become depressed. The user may become unconscious or comatose, and paradoxically, despite its depressant effects, seizures may occur in some overdoses. Now, one of the things that we know is that GHB is very reinforcing. It's kind of interesting though, because the reinforcing effects are actually considerably milder than probably any of the other drugs that we've talked about. We do know that GHB does exert rewarding and reinforcing effects in laboratory animals. However, one of the things that we're going to find is that the dosage and the experimental conditions matter. And this is something that we haven't really seen with a lot of other drugs that we've talked about at this point. So animal studies have ultimately kind of found some mixed effects. Now, looking at rats and mice, there has been evidence for place conditioning, going to a place that's associated with GHB. The rats and mice prefer that. They've also found evidence for self-administration, particularly if GHB is micro-injected into the ventral tegmental area. But GHB administration through IV in monkeys found much weaker reinforcing properties. So the effects are mixed, but it's kind of clear that the dosage you take matters and the experimental conditions that you're using matter. So like I mentioned, in self-administration tests, baboons that were trained to lever press for cocaine did not always respond to GHB. So the effects of reinforcement aren't as nearly as robust as we've seen with other types of drugs. So here you're looking at the baboons with these different reinforcing properties. So you can see we've got our baboons that were trained on cocaine, and you can see that just in general, they really love cocaine. Look at all of that lever pressing. They're pressing like 8 injections per day, although it does kind of vary. And then they get a vehicle of saline, and of course we get the standard extinction of the lever pressing response. As a control condition, again, we bring back cocaine, and in general, yeah, the baboons really like it. But then we get GHB. And here's what I want you to notice is that it kind of differs from baboon to baboon. This one, yeah, it's a little reinforcing, but definitely not as much as cocaine. For baboon number 3, yeah, they like this about as much as cocaine. This one's kind of variable. This one doesn't really like it as much. This one does. But you can kind of see that we've got some variable responses here in a way that we really don't see with highly reinforcing drugs like cocaine. Now, we do know that obviously because GHB is a GABA byproduct, it's going to affect some GABA receptors. So exogenous GHB from recreational or therapeutic use does elevate brain GHB concentrations. And in particular, it's going to activate GABA B receptors, and GHB, surprisingly enough, is only a weak agonist. It's actually not a very strong agonist for GABA B receptors. Now, interestingly enough, GHB can be used to treat narcolepsy. So the sodium salt of GHB is known as sodium oxybate. It's also known as the name Xyrem. And it is one great approved treatment for working with narcolepsy. I mentioned that GHB deepens sleep. And one of the things that we do know is that GHB does improve nighttime sleep, and it does reduce the daytime sleepiness and the attacks of cataplexy that people with narcolepsy often tend to experience. For those who don't know, cataplexy is a sudden loss of muscle control. And this is something that could last a few seconds, but it could be a little bit longer. It could last for several minutes. Now, using Xyrem can be really dangerous. So because of its abuse potential, we actually have what is called the Xyrem Success Program. And it's basically designed to make sure that Xyrem is getting in the hands of people who need it, and it's not being diverted to people who might use it for recreational purposes or to misuse it. So this means a few different things. It includes a single source manufacture. It's only manufactured in one place. It is distributed through a central pharmacy. It involves educating both physicians and patients, and there are patient and physician registries, and it's generally quite successful. It's now actually known as the Xyrem REMS program. Now, there are some other potential medical uses of GHB. In Europe, it's actually used as an IV anesthetic in its Xyrem form. And in Italy and Austria, researchers have actually found that it's really good for treating alcohol use disorder, particularly with treating withdrawal symptoms and preventing relapse. And that's because GHB does have a little bit of cross tolerance with alcohol. Now, I mentioned recreational use of GHB before, and the reason that people would want to take this is because there's a lot of positive effects here, and I think I forgot what to add here, so I'll just kind of add a little bit more that was not included on this slide. You're going to experience things like euphoria, heightened sexuality and sensory perception, feelings of relaxation, and disinhibition. In higher dose scenarios, you may experience a loss of consciousness or a temporary loss of memory, but this is going to be followed by a come down that a lot of users really don't like, and it seems to be pretty unpleasant. This includes things like sluggishness, mental confusion and amnesia, increased arousal, anxiety, agitation, and difficulty sleeping. So here are some commonly reported experiences during and after GHB use, and you can kind of see they do tend to be opposites. So during GHB use, you will experience euphoria, you'll later experience agitation and anxiety, enhanced sexual experience, increased feelings of well-being, feelings of relaxation and tranquility, heightened sensory perception, disinhibition, loss of consciousness, sluggishness and exhaustion after the come down, amnesia, confusion, anxiety, insomnia, weakness, and agitation. Now, what are some of the different risks of GHB use? Intoxicated states are going to be really similar to alcohol intoxication, and researchers have actually found that GHB has been implicated in some instances of driving under the influence. Overdose can cause an acute toxic reaction, including unconsciousness or coma, respiratory depression, bradycardia, which is a lowering of the heart rate, and hypotension, a lowering of blood pressure. Now, we do know that repeated use can lead to tolerance. Chronic GHB use by humans can elicit a tolerance, a dependence, and a withdrawal. As we've kind of talked about, withdrawal will include the following symptoms like anxiety, agitation, tremor, tachycardia, insomnia, and confusion. And in extreme cases, users may experience hallucinations and delirium. So, how do we treat withdrawal? Researchers have found that withdrawal typically is treated with high doses of benzodiazepines like Valium and Xanax, but they're not always effective. So people have actually looked at starting with Xyrem at a high starting dose and then basically tapering off and reducing the concentration until the individual is symptom-free. Now, despite this, relapse is pretty common, particularly within the first 3 months. So folks, this is all I had. Next week, you're going to have an opportunity to learn about anabolic steroids, and I will see you next time.